go ahead and introduce Ann Weller of the Alliance for Culture and Ethnic Harmony to talk a little bit more about their organization.
Well, good afternoon, everyone. Good afternoon, everyone. I'm the editor for the Alliance for Cultural and Ethnic Harmony, and our mission in Holland is to work for justice, equal opportunity, appreciation for diversity, and cross-cultural understanding. We want West Michigan to be a place where everyone is welcome and respected and valued. We work through a variety of things. We'd have programs before the pandemic. They were monthly in person. We focus on racial and ethnic disparities in healthcare. This is our third program in that series. And also we focus on affordable housing, and we've done a number of programs about that, and we'll continue to. In addition to programs, we have partnerships with other justice organizations. We do a weekly in the community email that lists diversity and multicultural events, anti-racism resources, and job openings. And those are sent to about 1,400 email addresses. We provide scholarships to 4 young people who will be the first in their family to go to college. 2 of those were through Latin Americans United for Progress, and 2 were through Upward Bound, the TRIO program at Hub College. And also pre-pandemic, we had 2 social events a year. So all of the community was invited to our potluck in the park or our spring fundraiser silent auction and gathering for a dinner. So we'd like to welcome everybody to check out our website, become members, join us on this mission to make West Michigan a welcoming and respectful place for everyone. Thank you.
Thank you for that introduction, Anne. And again, I would like to mention that that website address link is in the Zoom chat. So if you all would like to visit that website for the Alliance for Culture and Ethnic Harmony to become a member or to learn more about what it is that the organization does for our community and the many different ways that they benefit our community, please click on that link in the Zoom chat box. With that, I would like to formally welcome you to Exploring Vaccine Skepticism in the Hispanic Latinx Community, a virtual discussion panel hosted by the Alliance for Culture and Ethnic Harmony in partnership with the Holland Museum. As Anne said, tonight's event is the 3rd in the series on racial disparities in healthcare, digging deeper. Previous programs included an overview of disparities and local efforts to help and exploring vaccine skepticism in the Black community. Our partner, the Holland Museum, is recording the program and will make it available on their YouTube channel next week. I would like to also note, excuse me one moment, I'm going to admit another event attendee. I would like to also note before we begin that people can use the chat function in Zoom to ask questions or make comments in Spanish. Natalie Martinez will be interpreting for tonight as needed. To put into perspective why we feel this topic we are discussing tonight is an important one, I'd like to share with you a statistic. According to the Michigan Coronavirus Racial Disparities Task Force interim report, the cumulative COVID-19 case rate per million population among Hispanic and Latino persons in Michigan has been over 70% higher than the rate in white populations. Our goal for this event is to highlight what challenges the Hispanic Latinx community has in trusting medical professionals historically and the COVID-19 vaccine specifically, to provide insight and comparisons on the FDA approved vaccines, and to discuss how we can move forward in our community to ensuring all who wish to receive the vaccine have access to it, and understanding from others why some may choose to abstain at this time. With that, I would like to introduce our panelists for the evening. Dr. Irving E. Vega is an associate professor in the Department of Translational Neuroscience at Michigan State University's College of Human Medicine. He has also developed undergraduate programs to increase diversity in the field of neuroscience. He is a graduate of the University of Puerto Rico Mayunes campus and received his doctorate in cell biology and neuroscience from Rutgers University. Guillermo Flores is in his residency for his MD degree from MSU College of Human Medicine, Grand Rapids. He is a graduate of Holland High School and Hope College, where he received a bachelor's degree in biochemistry and molecular biology. His doctorate is from the Van Andel Institute Graduate School. Our next panelist, Joanna Rodriguez, unfortunately was not able to be present with us today due to unexpected circumstances, but has submitted her responses to the questions we will later see to still be able to share her insight with us. She is a registered nurse who works at Spectrum Health under the Healthier Communities Core Health Program, providing education and self-management of several diseases. Prior to this, she was involved with heart disease prevention in the Latinx communities. Throughout Glasshauer, senior epidemiologist with the Ottawa County Health Department, is also with us today and will be sharing his insight on these topics. Sarah Yor Van Oosterhout, Esquire, founder and managing attorney at Lighthouse Immigrant Advocates, a nonprofit immigration law office here in Holland. She is a graduate of the Michigan State University College of Law, formerly an attorney at the Diocese of Grand Rapids, and a board member of the Immigration Law section of the Michigan State Bar Association. Tom Eggleston, pastoral care minister at St. Francis de Sales Catholic Parish, Holland, Michigan, and a writer for the Church Life Journal and its blog on spirituality and culture. He has a Master's of Divinity degree from the University of Notre Dame. So thank you again to all of our panelists who will be with us today, sharing their insight and knowledge on the following topics. We do have some questions and some information to share with you all in the form of guided dialogue. Our hope, though, is that with this information and the initial questions we pose to our panelists, that you all as attendees feel comfortable with asking questions of your own, and that our panelists also are welcome to share additional insight and knowledge they have from their working professional backgrounds and personal experiences to, again, further shed light on the topics that we are discussing today. Our first topic for today is the elements of fear and mistrust that do exist for some individuals in the Hispanic Latinx community as it relates to seeking medical professional care. For many Hispanic Latinx immigrants during the early portion of the 20th century, first experiences with this country were with the Bureau of Immigration and Medicine. The first encounters that occurred in El Paso, Texas, under the Santa Fe Street Bridge. The United States Public Health Service and the Bureau of Immigration set up a quarantine there in El Paso to combat the idea that all Mexican immigrants were considered vermin infested. This idea gave substantiated evidence for the cleansing of Mexicans at the U.S. border. Each border crosser was subjected to have all clothes chemically washed and a scalp check. For those who failed the scalp check, they had to undergo further treatment to remove lice. And finally, before the returning of clothes, they were subjected to a shower of a mixture of soap, kerosene, and water. At the facility, 871,639 people were inspected, and 69,674 approximately were disinfected in the period of the first 4 months. This quarantine and treatment of Mexican immigrants continued until the early 1940s. To further add to the sentiment of distrust among some of the Latin American population here in the U.S., there were incidents that continued to occur well into the 1960s and 1970s, including mass forced sterilization. During this time period, forced sterilization among many poor minorities in this country, specifically the sterilization of Latino women, occurred in areas that contained high percentages of the Latino population. For example, Mexicans in LA, California, Los Angeles, California, and Puerto Ricans in New York. Doctors were purposely using their power as physicians to warrant authority on patients that they deemed needed sterilization. Eugenic beliefs were widespread among decision-making judges, parole officers, physicians, and superintendents, who sought to prevent the reproduction of the unfit and were eager to play a part in creating a better future. Diagnoses of insane or feeble-minded were often used as justifications for forced sterilizations. California was one of the most prolific of these eugenic sterilization sites, performing 1/3 of the 60,000 operations recorded nationally. The situation became so severe that it eventually made its way to court. For individuals, again, as I mentioned, we would be only briefly referencing historical incidents just due to time. And if anybody would like to know more specifically about mass forced sterilization, I do recommend that they watch the documentary No Más Bebés or No More Babies. That's what that visual image there is in reference to. It is a well done documentary that gives a much more in-depth overview of the topic that we are just briefly mentioning here today. Disappointingly, similar practices are still seen today. A recent example found evidence of violation of COVID-19 guidelines, forced hysterectomies, and maltreatment at immigrant detention centers, where Latinos constitute the majority of those detained. These incidents are still being investigated. History is not the only factor that plays a role in the dire care of Latinos in the United States. There also seems to be contemporary issues that cause distrust in medical professionals by the Latinx community, such as lack of effective communication between patient and provider, and lack of cultural competency. Now that we have taken a historical look at the Hispanic Latinx community's mistrust of medical professionals, we would like to ask our panelists, particularly those in the science and medical field, the following questions. For starters, in your experience, have you found historical events of medical mistreatment like these influence the hesitancy that the Hispanic Latinx community is demonstrating toward the COVID-19 vaccine, and perhaps even generally speaking when it comes to seeking any kind of medical treatment? And I would like to open it up to whichever of our panelists would like to respond to that question first.
I guess I can go. So I appreciate the kind of promotion, but I want to make it clear I'm not a resident. I'm a med student, so I'm like 3/4 of an MD. Just want to put that out there. So I apologize for any ignorance. But I guess my experience going through my clinical rotations has been, I know, and I have to take into consideration the fact that I know it's kind of biased because, you know, I'm only seeing people that are willing to go seek out healthcare. So taking that into consideration, I have had the chance to work with a lot of the Latinx community, and it seems that it's less of a, you know, you're giving these examples of horrific, like just medical malpractice. And I mean, personally, I feel like I have to carry this forward, at least the understanding, because we don't want to repeat these kind of things, or as was being pointed out, like discussing things like this still kind of happens. And I feel like the Latino community has every reason to be super mistrustful for a lot of the things that medicine has done. But it seems that in this population, doesn't seem to be the biggest driver for why people aren't getting medical treatment. It seems more of an access issue, if anything. So access to getting to the doctor, access of getting transportation, a large percentage of the community is uninsured, whether they can even afford it. And there's also maybe not the same exposure to some of the medical literature and that kind of thing, not even just access to like internet and other resources, but resources in Spanish or their native language if it's not Spanish. And then there's always the fear of things like deportation, since we know a large percentage of, well, in Latino community, you know, we have the undocumented population that sometimes fears, and they shouldn't be having these fears, but in the back of the mind, there's always this, you know, should I come seek help if I think it might if I might end up in more trouble for it? So from what I've seen, and again, having the bias of it's only going to be those willing to seek it out, I've seen that be more of an issue than these gross like medical malpractice stories.
Thank you for that insight, Guillermo. Are there any other panelists who would like to respond to this first question, or again, additionally provide any other insights that they have knowledge of due to personal experiences, as Guillermo had commented himself?
I would like to add that I agree. Well, first of all, I agree with you, Guillermo, that access is one of the main issues in that promote to health disparities. In my research in health disparities associated to Alzheimer's disease and related dementias, trust still is a problem with the healthcare providers. And even when people get access, the recent report from the Alzheimer's Association indicates that there is institutional racism in areas in the system of healthcare, and that it was just published this year. So institutional racism is a barrier for access, not only the socioeconomic aspect, but also the still present institutional racism that sometimes is actually behind what we call implicit bias that then leads to institutional biases and way to differentially treat people of color. That actually affects the trust of people to reach healthcare and affects the communication that has to be built between the physician and the patient. So one way that we can achieve a more equity and more inclusion in the healthcare provider, in the healthcare, is to actually provide these healthcare opportunities within communities. I think COVID-19 has shown us that maintaining a community healthy will actually help us to get out of a pandemic. Now we're talking about COVID-19. I bet that in less than 100 years, we're going to see another pandemic. So we need to change the way that healthcare is provided, the traditional way of having institutions built with these magnificent buildings in which it seems to be scary to people to see whether they can afford getting healthcare, and change the system to a more community-based healthcare where the point of care is closer to the community within the people that they trust. And that way, I think we can, bringing that point of care closer to the community, we can not only provide the care that is needed, but also have a surveillance system that allows to cut specific changes in the disease or the health problems that affects specifically the communities. So the bottom line is that we don't change the way that we traditionally continue providing healthcare. We're gonna try to see we have a different result trying the same thing. And we know for years that is not working. So we need to change the way we provide care in this country.
Thank you for that response, Dr. Vega. And I guess as a follow-up question for our audience, is there any role that cultural competency plays in building that trust relationship between a medical provider and their patient? I don't know if any of our panelists, yourself included, Dr. Vega, could perhaps speak to that, if that is at all relevant.
It is an important component in training and understanding. And I know that at least locally and many places of many healthcare providers that I know already have institutionalized culturally sensitive and culturally awareness projects, diversity, inclusion, and equity training. And you talk to any healthcare provider system and they will tell you that they have an office for diversity, equity, inclusion, and they have all the things that they have done. The problem is accountability. The problem is how these organizations develop these departments within the organization that actually pay employees for the same organization. And then there is this institutional bias, and then this political, administrative system within the organization that is very difficult to promote change and say, you are doing this wrong, without getting into, difficult conversations. So again, we are trying to replicate and try to show that we're doing something, but it's doing the same thing, trying to obtain a different result. We need to actually have independent oversights and in that way provide a more accountability to this kind of phenomenon where the patients feel comfortable complaining too. I remember there is a power difference here between a physician and a patient, and how that issues of racism or the communication, how the patient was treated and all that, they will look for another physician or will never go to the healthcare again, but they will fear to complain about it because there is a power difference between the physician and the patient. So there is this need to establish independent ways to promote accountability. And again, I want to emphasize that we need to change into a more community-based healthcare, where the people from the same community are trying to understand and trying to help their own community. You guys are doing it. You know where the issues are in Holland. You know what are the issues in around your area, and you actually develop a strategy to how to solve it. If we implement that at the level of healthcare, we're going to be better off to respond to the needs of our community.
If I could just follow up also with just a brief comment. This is a little bit outside of my area of expertise, but I just wanted to say, to follow up with what Dr. Vega is saying, employing the community resources. One thing that is that seems to be a great strength, but also a great need is partnering with organizations that that ethnic groups trust inherently. That there is a way to figure out ways of giving access to healthcare or other needs by partnering with for example, churches and schools and that sort of thing that are deeply trusted within communities already. This is a little bit of an anecdote, but we have a food pantry at the church where I work. And what we have been finding is that people who seek food for the first time in this pandemic are going to that food pantry because it's out of a place that is already trusted, that it's out of the church and already inherently trusted. And places that are partnering with access to healthcare are experiencing the same thing, that people, when vaccines are being distributed at places where people already trust and are comfortable, seem to be having success with that.
Actually, I want to I want to actually second that with giving a quick example that is happening here in Grand Rapids. At the DeVos place, the vaccination of Latinos has been very difficult to recruit and to schedule for the Latino community. However, when you go to the Hispanic Center or Cesar Chavez or other within the community, they actually have to put waiting list of people to vaccinate. So again, it goes to what Tom is mentioning, and I just wanted to say that that's key. Thank you for sharing that.
Yes, thank you, Tom and Dr. Vega for sharing those comments. I would like to go ahead and share Joanna's response. Again, she was able to send us her comments on these questions, even in her physical absence. And Joanna is, again, our panelist who is a registered nurse at Spectrum Health. And so in response to the first question, Joanna comments this: my experience has been word of mouth. Patients will express concern if people they trust in the community, family, or friends have experienced mistreatment. For example, a family member was misdiagnosed or not rendered proper treatment for a diagnosis, or did not receive optimal care that resulted in lifelong complications or worse, death. The vaccine is the same. She goes on to say that her aunt and her cousin received the vaccine and they had bad side effects. And so using that as an example, that for her and her experience, the Latinx community are not taking a sideline. They are speaking up for their health and for the health of their family and relatives. And before we move on to the second question, then I'd like to make sure that there aren't any additional comments that panelists would like to share.
Hey, this is Darrell. Do you mind if I say something?
Yes.
I love all the insights that everyone has brought forward. It's about some of the sort of intimidation of our current medical structure. I can say that if I'm in an urban area, sometimes I have a hard time finding the door to even get in. If I get in, then I may be faced with communication issues and power differentials, all the things that Dr. Vega had talked about. And kind of going back to the original examples of sort of the traumatizing and terrible experiences that you read through, Yada, is that those things can have kind of a generational effect. They call it a generational trauma, where if something bad happens to my grandparents, it echoes in the generations afterwards. In the sense that if something bad happened to my mom and dad when they were seeking care, they're gonna probably not encourage me to go seek care. So some of these bad effects that happened a long time ago, it may seem like, yeah, that happened 100 years ago, but that can still echo into the future. So we want to try to break that cycle. And part of it is to what Guillermo hinted at, is that we want to bring these things to the fore, to remember them so we don't make these mistakes again, so that we can have accountability like Dr. Vega had talked about, and do a better job of making sure that there's accountability that's independent. So I just kind of want to bring up that part of the sort of healing is having conversations like these, keeping communication open, and just recognizing that some of these terrible things can echo through the generations. And like Joanna mentioned, if we hear about bad things or side effects in the community, that has an impact on the decisions we make. If I find out my cousin, had a fever after they had a vaccination, it might affect my decision. So we just want to keep those communication channels open, and just recognize the need for things like accountability.
Thank you for those additional comments. I definitely agree. Even in my own personal experience, and it doesn't necessarily, I think, even need to be medical treatment, right? We listen to our family or relatives about their personal experiences on a lot of different topics, and I mean, that's also kind of marketing strategies, right? A company knows how to market a product because the person's family has been using it for generations, and they kind of go off of that family familiarity and those experiences. So I definitely think that is something that goes into hesitancy when it comes to seeking medical care for the Latinx community. So with that being said, I would like to go on to our next question, which a lot of our panelists touched on this. So our next question is, are there any other factors in your experience that could possibly be contributing to this hesitancy in taking the COVID-19 vaccine? And also when it just comes to seeking general medical treatment. So again, I know our panelists responded within the first question a little bit towards the second one. Are there any other factors, though, that perhaps haven't been mentioned yet that come to mind for any of you as working professionals in your field, or again, just based on personal experiences?
So I'd like to add on this one. One thing that's not been brought up is just the level of government involvement in this particular medical initiative. And obviously there needs to be for good reason. But when you're talking about the Latinx population and you look at just even the last 4 years of you know, their relationship with the federal government, it's not a relationship that has imbued trust. Like, if anything, like it has just created widespread fear and distrust of the federal government, the state government, and any entity related to the government. And so with so much government involvement in this particular medical initiative, you're seeing like in this goes even beyond what Dr. Vega mentioned about systemic racism in the medical field. You know, this is historical. We're talking about, like, you know, 19th century onward othering of immigrant populations through immigration law and policy. And so, like, it has not created this relationship of trust between our immigrant population, the Latinx population in general, and the federal government. So it's to have a federal entity, a state entity saying, you must get this, we want you to get this, like, they're not automatically going to say, yes, we've got this like historically great relationship. You've always told me what to do, and it's always been great for me. Like, never mind the fact that you rounded us up in 1954 and shipped, you know, thousands of us back across the border. Like automatically there's this huge distrust, and they're not going to be willing to sign up for this vaccine that the government is telling them to register for. And like, in addition to that, and yet, like, I just got my first dose a couple weeks ago, and I drive up to this place, and like, there are police, military, like all kinds of like official government looking people. And we brought one of my employees / clients with me, who is terrified of law enforcement and anyone related to like military, just because of past trauma in his own country. So we drive up to this place, and we're like, we go inside, and we texted him from inside, and we're like, look, man, you need to like brace yourself, because there's lots of military and law enforcement within this facility. Like, that has a huge chilling effect. Like, just the very presence of anything resembling law enforcement, military, can automatically turn the Latinx population away. So again, the point I'm trying to make is just like the level of government involvement in this particular initiative is in and of itself very chilling, and is something that we as people promoting this need to be aware of. And I know that it's unavoidable. And I know that, you know, when we're doing these huge vaccination clinics, we just don't have the resources within, you know, like Spectrum Health, hospital, the health department, to make it exclusively healthcare workers. We do need to bring in the National Guard, Air Force. Like, it's necessary in order to actually vaccinate everyone who needs this. But we also need to be sensitive to the fact that that's going to turn a lot of people away. And so, like Tom was pointing out, maybe we need to be more intentional about offering alternative locations where we reserve more of these less scary healthcare workers to administer the vaccines. Like, it seems like a less intimidating experience for people without people in fatigues and you know, full body armor, you know, guns walking around. And I know that that's going to take a little bit more work on the part of Ottawa County or these counties that are administering. But honestly, like, it's such an enormous barrier to this population.
I would like, I really appreciate that comment from you, Sarah. It is really important. It would, but the COVID-19 pandemic came in the worst time possible. We were in the middle of the elections, and the political rhetoric was really harmful. Another barrier that emanates from that political rhetoric that happened last year in the middle of the pandemic is that serve as a platform for the miscommunication in social media and everywhere. And that is another barrier that our Latino Hispanic population is actually dealing with. They hear these stories, and then the problem is that these false stories out there and misinformation, because of political rhetoric, is actually being bring forward or actually given authority or legitimize them, because it's actually being said by a political person or someone of that is recognized within the community. And that's a huge problem and another barrier that we need to take in consideration: the miscommunication, the need to inform our community that they need to find legitimate sources of information that provide well-documented and scientifically based information that they can use then to make decisions. So that's another barrier that emanates from the the government and the government as a venue to have these conversations, this debate that during the elections that actually now create this environment of miscommunication and misinformation out there.
Yeah, I'd like to echo some of what Irving was just saying. It's so annoying and just like infuriating on my side. Just like, why and when, I mean, did like health and science become like a political thing? And we're already talking about a community that already has some mistrust in the medical system and have access problems and all this other thing. And as was mentioned earlier, higher rates compared to the, I guess, general population, and vaccination rates lower than the general population. People are dying because of this mistrust, because of the rhetoric, because of this misinformation. And it's very frustrating at the level of, someone in the medical field seeing this, and it's really sad. I guess one hope about distribution is that it seems more and more places at more of this community-based level are opening up to distribute some of these vaccines. Early on, it was more of a like, how can we give the most vaccine to the people that need it right away, and these mass vaccine clinics are opening up. But I saw some of the best responses for patients that maybe were on the fence about receiving this vaccine, and more kind of these community settings, these smaller clinics where they might not have the same volume of the vaccine that they can provide, but at least they're a little more trusted, and hopefully these numbers can continue to increase, because I feel like we gotta do everything we can to make it easy for people to get this so that we are saving lives. So I do think that, the community-based kind of strategy is something that's incredibly important. And something that I think hasn't been touched on yet is that, we're talking about the science and the medicine and all these numbers and all these data. Like, we get all this information, and for me, I can see this and understand it, but I think we do a very bad job of explaining what a lot of this means too. So when we're talking about like differences between vaccines, or, my friend got sick on the vaccine, but I also have a friend that got sick with COVID, but was perfectly fine. You get these anecdotes, and you don't have it in a, you don't have the data and the science like in an easily digestible kind of way for the public, which I think really does a disservice too. So I think on the medical side of things, we have to do a better job of communicating better in general, and additionally communicate it to more vulnerable populations.
If I could too, I just wanted to chime in on just like the human side of the human family side of what's going on, specifically with the undocumented population, undocumented immigrants. And Sarah began to touch on that, and that's what made me think of this. But when you are an undocumented immigrant, you are doing a constant risk assessment on how you are able to ask for help, where you're able to ask for help, because you're putting yourself out there, and it's viewed as opening up a risk of drawing attention to yourself, which is a scary thing. So so signing up to get a vaccine is one thing, but then even transportation to the place where you'll be receiving the vaccine, driving is a risk. So there's risk everywhere that people are having to evaluate constantly in their lives. And then people we've begun to hear these rumors that upon asking for a vaccine, you have to present a driver's license or something like that, which I wonder, Sarah, if you could clear up, but these rumors just begin to spread and compound, and this risk evaluation that people are doing begins to say, I think this is too risky to ask for this vaccine at this time.
I just want to jump in and go back to that trust issue. So one of the things that we are commonly hearing from our clients is like, this vaccine was developed so quickly. And so there's this fear that it's really just not a reliable vaccine, that they can't trust it because it happened so quickly. And one of the things that has been brought to my attention is pointing out that other diseases that continue to plague, especially communities of color, and especially international populations, thinking like dengue fever, Ebola, like their AIDS, like there's no cure, there's no vaccine for any of these illnesses that, wipe out populations in other countries, particularly indigent populations of color. There's no cure for these. And so like, you have a lot of people asking like, well, how are you able to develop a vaccine in such a short amount of time for this? But there's no vaccine for this that's been, an issue for my country for, decades. And part of that's this misinformation piece. People need to understand that there's a lot of money tied up in this particular vaccine, that given just the amount of global governments seeking this vaccine and willing to pay for it with a lot of money, like these are huge contracts. And so of course, Moderna and Pfizer and Johnson & Johnson are going to be rushing to manufacture this particular vaccine. But just addressing, even that economic argument for people and putting it within that perspective, like, yeah, it's hella unfair, but like, this is what's driving this. So just because it happened at warp speed doesn't mean that it's not reliable. It just means that there was a lot of money behind it. And so the other thing, everybody keeps talking about how it's so important that we educate. I think the dilemma at this point is, especially over the last 4 years, is what's trustworthy? Like, how do people know that they can trust the Ottawa County Health Department? How do people know that they can trust this particular news outlet versus this one? Like, I was at a salon the other day and a Newsmax advertisement came on, and like, I'm listening to the rhetoric about the immigrant population just seething, but thinking, there's a huge proportion of this population that actually hears this and thinks it's true. And so like news, like it's hard to tell what's real news and what's fake news these days. And it's so much so an issue, or so much more so an issue for populations that don't speak English and are getting their news from, word of mouth. That is what I am most commonly finding with the population that I am serving at my office, is they're hearing it from their neighbor, or the woman who takes care of their kids, or the lady at the grocery store told me this. Like, that's a lot of times the source of news. Or as Yada points out, like there's this family trust, there's this like nucleus of trust, and they'll go find information there. And it's something that we're combating even within the legal field, is trying to get people to understand there are experts that you go to ask questions about your immigration status. You don't ask, the tax lady. And so I think part of it is like even more fundamental than making sure that we get the information out, is making sure that we're educating people about what is an actual reliable resource, and then making sure that that reliable resource, like the Ottawa County Health Department, actually provides information in their language in an accessible form. Accessibility at this point has been an incredible barrier for the clients we serve. Like, stop making everything online. Stop putting QR codes and web addresses. Like, that is not accessible to the populations we're serving. So yeah, even more fundamental than making sure that there's good information, because there's good information. And the CDC and other organizations are working really hard to make sure that it's accessible in multiple languages. But what we need to do is like go even more basic than that, and like start talking to people about, your auntie is not a medical professional. You need to be looking at this resource, because this is where you're going to find reliable information about this. This is trustworthy information. And again, maybe that needs to come from Father Charlie at St. Francis de Sales, or some trusted person within the community. But I think it's far more fundamental than even making sure that there's accurate information.
I would like to add to that what Guillermo mentioned before about our, meaning scientific community, being ill-prepared to communicate during this pandemic. Something that I have tried my years, preparing the next generation of scientists, is actually to promote activity in the communities so that they learn how to communicate the science. To the question that the point that Sarah brings, that these vaccines were developed, in a year. The technology behind Pfizer and Moderna vaccines were developed in the 90s and have been tested in cancer research, in clinical trials in cancer research for decades. The only thing that happened is that now this new technology became in prime time because of the need to use it for this COVID-19 pandemic. It was there in the pipeline. It actually, there was a lot of debate in the scientific community of whether this technology was better than the traditional way of making vaccines, which actually take years to make. And now, because the technology proved for these decades of research that it was easy to respond, easy to change, easy to adapt to what the disease that they wanted to treat it, the COVID-19 pandemic was actually gave the opportunity to test the technology, but it has been in testing for decades. And we were fortunate that that technology was actually available, that it was a change on the message now to just make it specific for SARS-CoV-2. And that's it. That was the only thing that they needed to do because the technology was already developed. So it's the scientific community lack of preparation to communicate in a way that is accessible to everyone is actually, it fueled the problems that we see in the community. It was it's our fault that we were not able to communicate properly.
Thank
I would
you.
like to I would like to make a comment on the untrustworthiness of the CDC and the EPA, if I may. Or is there no more time?
I would say let's go ahead and have this question, and then we will go ahead and move on to legal barriers specifically. I know we touched on some, but we will specifically go to that section after this question. Go ahead, Bob.
Yeah, on the news media this past week, they commented on the CDC and the EPA trustworthiness, 0. For decades, they've been lying, they continue to lie and not accountable because they are government. So that should answer that one. So you cannot trust them. And they'll admit it. They already were in court, they admitted it. They don't care because they're not accountable. And my other issue would be trustworthiness or untrustworthiness. We're dealing now with the government, federal government, bringing in children from South America. Children. We have, if you're a parent, you have a child, you're not gonna let any doctor, anyone in the medical field just do as they want with your child without you authorizing that. Now, these children don't have the parents, and they will be bringing some of these children to Albion, Michigan. Who will be overseeing them? What Latino community agency will be overseeing their health and welfare of these children? No one. So these children are going to go through what we're talking about. The adults are going through, have been going through. It's a sad thing. It's going to just repeat itself because these are children. They're going to say, oh, they're going to ask them to take the shot, right? The vaccine, which we know is not medicine. We know it isn't. I don't care how many decades they tested this stuff. So they're going to go to the fear. If they see one of their little friends there die, what do you think is going to happen? They're going to be in fear. So who's going to be overseeing these children, Latino children? No one. So that's my comment. Thank you.
Well, I would say that I would say that we might not have the information to answer that question.
I'll just quick say that at least on my end of things, I'm not sure where you get the 0% whatever accountability, trustability of the CDC. As someone who is, in the medical field, it's pretty well trusted. We use it for a lot
It
of
seems
information.
very specific in terms of direct.
I don't know if I was cutting out or what was going on.
Yeah, I think Yada had problem with the internet. Yada, you were breaking out. Now you're muted.
Sorry, I apologize for that. I think my internet is now stable again. Guillermo, I apologize for the interruption there. You could please continue with your response.
Yeah, all I want to say is, I don't know where that 0% accountability or whatever came for the CDC. As someone in medicine, I know that we use the recommendations and they're kind of the gold standard for a lot of the recommendations. It's not just the government telling you what to do. There's a lot of science backing it up. And I think among a lot of the sources, they're pretty good about telling you when they don't know things. And in medicine, one good thing is that there's a shift between like evidence bases. So like, how good is the evidence? Is this just something we do because we've always done it? Is this something we do because, hypothetically, theoretically, this should be the case? Or is this something that's been tested at a nationwide level? They'll grade it. You can see it. They have links. They'll give you the data. If you, at the end of the day, don't want to trust any of it, that's up to you. But as far as the vetting, it's about as good as it gets.
And thank you for that response, Guillermo, to the question posed. Just again, for the sake of time, I would like to kind of wrap up this section. And I will briefly reference Joanna's comment here again, and what other factors. She definitely echoes a lot of what our panelists had said, that when she did come in contact with patients who were hesitant to take the COVID-19 vaccine, even when presented with information about the development, they still refused it. That she found that once they spoke to individuals that they knew, that they trusted, who had received the vaccine, that they quickly said, hey, sign me up. How can I get registered for this? She does also note that QR codes and online sort of technologies in reference to signing up and registration, as Sarah noted, have been barriers in her experience as well. And then I would also like to reference just a quick chat comment in the Zoom chat box that was a little bit in reference to what Sarah had shared about military presence being at certain vaccination clinics and how that can kind of be off-putting. The Ottawa County Department of Public Health asked the National Guard personnel could not wear their uniforms, as I believe, so this comment comes from Ann Weller. I believe that in other cases, I'm not sure if it was with the National Guard or another military branch, that they were able to do that they were able to not necessarily wear their uniforms when they were at the vaccine clinic, which did help with some of that hesitancy. And I think the other thing kind of to note in relation to that in Sarah's comment is the fact that Sarah, in her comment, had mentioned that they said to the individual who they knew had some fear, some mistrust with the military, that they were going to be present. And I think that helps in that situation. And I know that the Ottawa County Health Department, during their vaccine community clinic discussions that they do in partnership with organizations in the Holland area that serve the Latinx community as well as other ethnic minority populations, that they have made it a point to provide that information of who is going to be the people vaccinating that particular day, to give individuals a heads up, basically, and to be able to ease some of that anxiety. So thank you again to all of our panelists who responded to those questions. And so moving on now more to specifically legal barriers when it comes to getting the COVID-19 vaccine, and then again, and generally speaking, medical treatment. So specifically, are there any barriers for migrant workers or non-citizens to receiving the COVID-19 vaccine or other medical treatments? Generally speaking, what are other concerns that have been raised, again, to all of our panelists in relation to legal barriers? And I know some of the legal barriers have already been touched, but are there any other ones that could be shared with our event attendees tonight?
So as the lawyer in the group, I will jump on this one real quick. So like Tom touched on this in general, or already. So in general, when you're working with the undocumented population, you need to understand that their life is lived constantly during this risk evaluation, this balancing test, whether it's getting behind the wheel of their vehicle and driving their kid to school or to the grocery store, or stepping foot into the workplace, or going to the hospital to seek medical treatment. Like, it's always a risk evaluation. And the constant concern, especially when we're talking about people without immigration status, is this going to result in me being separated from my family? Or is this going to result in me being detained or deported from the United States? And that's something that the general populace really has to grapple with. Like, I never think that when I get behind the wheel of my car. I never think that as I'm driving my girls to school, as I'm walking through the grocery store, when I have to take my accident-prone 7-year-old to the emergency room on the regular, like, I'm not thinking like, am I going to get deported because of this? Am I going to be separated from my family? It's just not something that people with regularized immigration status or US immigration status have to think about. I mean, people who have started out undocumented or people who have had to go through the immigration system, I think are aware of and familiar with those fears. Or people who know people who or come from mixed status families. Like, there's a little more intimacy with that particular like risk evaluation, a greater understanding. And, that's why I, as a white woman, am aware of it, because I work with folks who are constantly evaluating this on the daily. And so I have a more intimate look at what it is to be a person with uncertain immigration status in the United States today. So that in and of itself is just an enormous legal barrier, is the absence of legal status. and just this absence of a sense of safety in our communities. The last 4 years of false rhetoric, fear mongering, and also just action on the part of our local law enforcement and ICE, CBP. For those of you who aren't aware, the entire state of Michigan is in the 100-mile border zone. And so in addition to ICE, immigrants in the state of Michigan also have to fear CBP, so Customs and Border Protection, because they have jurisdiction throughout the entire state. A lot of times they're riding around with state police. And so there's just this elevated sense of fear in our community. And so like being undocumented, like I said, in and of itself is a barrier. But then in addition to that, within the state of Michigan, being undocumented means you don't get a driver's license. We only at this point, so since 2008, the state of Michigan has only been giving driver's licenses to people with US citizenship and certain resident immigration statuses, or non-residents. Certain temporary workers have access to driver's licenses, but you have to provide proof of your immigration status in order to get that license. And so when we stop and think about what kind of, like, just the enormity of that barrier, back in March of 2020, we were looking at, food scarcity issues. And one of the things that came up was like, okay, well, we're having people do this, like drive up, pick up a box of food and leave. Well, we had this huge underserved population that couldn't drive up, like driving up in and of itself was a barrier. So driver's license. Not only is it a barrier because we're asking for ID at a lot of these clinics, it's a barrier because people can't get behind the wheel and get themselves to that clinic. So we have a transportation issue, and then we have an identification issue. And so one of the things that we've been hearing that's happening across the United States is that certain clinics, and this is happening most often with pharmacies, not with county initiated clinics, but pharmacies, they're asking for particular types of IDs. So the driver's license, the permanent residency card, or a social security card. Those are absolutely not necessary to get the vaccine. If you have a passport or some other form of photo ID, like a school ID, those work. But even for some people, like even having that international passport, I spoke with a family a couple of weeks ago, and they're terrified to even go apply for an international passport at their own consulate. So even that sometimes is a barrier. So like figuring out some way to educate people about what are the actual identification requirements is going to be enormous in breaking down this particular legal barrier for people. And then health insurance. Like folks aren't eligible for health insurance. There's this big misconception that you have to have health insurance in order to access the vaccine or medical care in general. Like it is just an enormous barrier to the immigrant population in general, that there isn't state-funded healthcare. Like emergency Medicare or Medicaid, sorry, is not really a fix for a lot of people. It works for pregnant moms and kiddos, but in terms of like, adult male population, especially, like that's just an absolute barrier to medical care. And honestly, like one of the most devastating impacts of this particular pandemic has been the healthcare expense for those who have been impacted by COVID. Just the amount of debt that people are going into because they need COVID-related care. Like after hospitals stopped carrying that financial barrier or burden, suddenly like people were taking on the cost of like their COVID complication care, and like that's just ruined families. So yeah, health insurance is another huge barrier for folks. And then, I'm looking at my notes real quick. And then just eligibility, like a lot of people think that their status makes them ineligible for the vaccine. And so we've worked really hard here in Ottawa County to educate people about this particular issue, that your status is not a factor in any of this, that you're eligible regardless of the type of ID you have and your immigration status. But still, like for so many years, status has been a barrier to so many things. It's been a barrier to like access to certain state-funded programs, and a barrier to getting a job, a barrier to accessing certain benefits that would help with paying healthcare or housing, or whatever. And so like, there's just this automatic assumption, because it's a government related program, that their immigration status is like just a guaranteed barrier to their access to the vaccine. So yeah, that's kind of my Cliff Notes version of what I've been seeing in the community. Tom, I see you shaking your head, so I'm sure you've got other things that you want to add, or maybe someone else. You're good, okay. But that's what I've got for right now.
Awesome. Thank you so much, Sarah, for giving us that insight when it comes to legal barriers, both from personal professional experience. Our next segment here, which is, I'm going to take a moment to pause because I think my internet connection is unstable again. Can everybody hear me all right now? Awesome, thank you. To talk about religious convictions and how that might influence the Hispanic Latinx community's decision to take the COVID-19 vaccine. Again, it's not something that is going to be 100% applicable for every individual, but just wanting to ask that question. What is the influence, if any, that religious convictions might be having an impact on to the decision to take the COVID-19 vaccine or not? And so with that, the first question, what is the stance that religious leaders have taken in regards to what is being communicated to church congregations about the COVID-19 vaccine? So what's the religious leaders, the religious community stance on the COVID-19 vaccine? If Tom, you wouldn't mind responding to that question.
Yeah, sure. Thank you, Yetta. Again, what you hinted at this, that religious leaders are not a monolith, that there's a huge disparity between what people are saying. And I want to say too that I'm a Roman Catholic minister. So the perspective that I'm coming from is from Catholicism. I'm a Catholic Christian. So that's where a lot of the grounding of what I know is coming from. But what I see religious leaders speaking to is looking at vaccination as being a movement toward the common good, that if persons are able to receive a vaccine, that it is adding to the well-being of our society, and that it is a moral and perhaps not just moral option, but it is the option that people should be doing. Again, this is from the Catholic perspective, but our Pope said that that if you're able, you should be receiving this vaccine. This is something that the Catholic bishops in the United States have also said. There has been some of the discussion on religious grounds has come from stances on deeply held stances on abortion. There have been some reports that there were cell lines from aborted fetuses that were used in the research done on the Johnson & Johnson vaccine in particular. So what our bishops have said in the Catholic faith is that given the option, one should request one of the other vaccines, but it is still perfectly moral to receive any of the vaccines available in the United States at this time. And people are encouraged to do so because in a certain sense, we are not just doing something that is not immoral, but also doing something that will protect those who are very vulnerable, that there's something admirable to receiving the vaccine.
I'd like just to mention, based on what was just said, so there's been no fetal tissue used. I just want to clear this up for Moderna and Pfizer. So these, no fetal tissue at all. You can make the argument that fetal tissue is used for Johnson because it's a cell line, meaning that at one point the cell was taken from fetal tissue, but this was, if I remember, it's like 35 years ago or something, and this has been grown. I'm not saying whether that's a good or bad thing, but I want to clear up the idea if anyone's thinking that the scientific community is collecting fetal material to make this. That's not at all the case. And there's none of it in the Pfizer and Moderna. And I guess you could make a case that in the Johnson & Johnson vaccine, there is some of that, but I just want to clear that up.
Thank you, Tom, and thank you, Guillermo, for providing that follow-up clarification. So with that being said, I would like to open up the discussion to specifically looking at data and comparisons of FDA-approved vaccines. And Darrell will be leading us in that discussion. Senior epidemiologist, again, from Ottawa County Health Department. So whenever you're ready, you please feel free to go ahead and share your screen.
Thank you, Yada. So, hi everyone. My name is Darrell, and I work for the Health Department here in Ottawa County. I am part of the government structure at Public Health. We operate with a perspective of wanting to bring health and good public health to our community. So, I'm going to talk about data. So, Guillermo, you talked about making sure that data is accessible. If there's any time you have a question or have some insights about the data that you see, please ask, because as a data person, sometimes I miss the forest for the trees. And also, Sarah, you're going to see a QR code, but I want to say that we have other options available. So I want to make sure that people are aware of those, because the Hispanic Latinx community, a lot of us have adopted, new technology. So there's a lot of people out there that use those. But you're right, there is a significant portion of a lot of different populations that don't have access to that kind of thing. So I want to make you all aware of those different things as well. And I'll just start kind of going through some slides and talking through some data. And I'm happy to take any questions through that. So I will try to keep things moving along. I just want to make sure that you guys can see my screen okay. Yada, will you just give me a verbal that you can see my screen?
Yes, we can see your screen.
Perfect. All right, so let's just dive right in. So just a quick disclaimer, COVID-19, it moves fast in the sense that there's always something new every day. And I just want to let you know that some of the data presented here is subject to change, just as our data gets updated and the pandemic continues to unfold. So I just appreciate everyone's patience and just understanding that some of the stuff that I have today may be outdated even tomorrow. So I want to talk a little bit starting about race and ethnicity of COVID-19 in the United States. So those kind of three topics: the nation, COVID-19, and race and ethnicity. And I know that this data might look a little bit complicated, but I really want to point out one thing, and that's disparity. So the difference about what we would expect and what we're actually seeing. And so there's a lot of bars on here, but if you can see my mouse kind of hovering, there's this gray bar here that shows the proportion of the Hispanic and Latinx population in the United States. And that's about 18% of the population. But this red bar is the number of cases, the proportion or percent of cases. So even though the Hispanic Latinx population makes up only 18% of the population in the United States, they carry 30% of the burden of COVID-19. And so you're seeing more COVID per capita in the Hispanic Latinx population than we'd expect. So this is a disparity. It's a real inequity that we're aware of. We want to make sure people are aware of, and so that we can talk and think through it. Same thing with deaths. We're looking for any kind of difference between the gray bar and the number of proportion of deaths that are occurring, and those are about equivalent. So you'll see on some other slides, the Hispanic and Latinx population is at risk, higher risk for death. It may not be immediately obvious in this slide, but just want to let you know that that is actually there. So move on to the next slide, talking about this from a cases, hospitalization, and death perspective. I just want to look at the red box here. And when we compare the Hispanic Latinx population to the white non-Hispanic population, the Hispanic population is 1.3 times more likely to become a case, 3.1 times more likely to be hospitalized, and 2.3 times more likely to pass away from COVID-19. So again, these are real disparities that we want to make sure that people are aware of. and also just highlight the importance of vaccination for everyone in the United States, but particularly for those that are higher risk for some of these more severe complications that would require hospitalization and death. We have a way to combat it, and just want to encourage everyone who's eligible to take it, but just be aware that behind the vaccine and all the data is also these disparities. So when we're talking about that same information in Ottawa County, I want to talk about kind of the backdrop of Ottawa County, stepping back from race and ethnicity for 1 second and just talk about the ages of the people that are getting sick and being hospitalized and passing away. In this graph, the percent of the population is sort of the expectation. So there's 13% of our population that is 0 to 9 years of age, 14 or 15% that's 10 to 19, and you can just follow the blue bars across. Basically, what we're looking for is any of the following bars: cases in gray, hospitalizations in blue, and the percent that died in red. If any of those are higher than the light blue line, we know that things are out of balance. And you can see that start to happen among the 60 to 69 crowd. A higher proportion of them are hospitalized. In the 77 to 79 crowd, more are hospitalized and more pass away. And if you're 80 years and older, there's a much larger burden of hospitalizations and deaths in these age groups. And I bring this up because it's an important consideration for our entire community, but in the Hispanic Latinx population, life expectancies are much higher than their white peers, than the Black population, and than the Asian population. So we may have more folks in the Latinx population that are surviving to the 80 plus group that may be more at risk for hospitalization and death. And also just a backdrop of our community, who's at most risk for COVID-19. All right, and when we dive into the same sort of disparities in the Hispanic Latinx population, same concept. Blue bar is what we'd expect in the population, and anything above that 10% for the Hispanic Latino population is a disparity. So we definitely see more cases, a higher proportion of cases than we'd expect among the Hispanic Latino population. And now more hospitalizations as well. So there's a disparity here. I'm thankful that we haven't seen a higher percent of deaths. It's a little bit lower than what we'd expect, just because 10% of our population in Ottawa County is Hispanic or Latino, but only 8.4% of our deaths have been among the Hispanic and Latino population. And then you can see the non-Hispanic population represented here as well, with some, I guess, equity when it comes to the percent of deaths, and then lower hospitalization and case rates. So we definitely see that our Hispanic and Latinx population is more affected by COVID-19 and those poor outcomes. This is a different way of looking at it. This is the pandemic since a long time ago. So this is going back to last summer, and just looking at the Hispanic Latino case rates in pink, and then the not Hispanic or Latino case rates in yellow. And don't worry so much about case rates, just recognize that whatever group has the higher number is more affected or carries more of the burden than we'd expect. So you can see that the Hispanic Latino population definitely is above their non-Hispanic peers at different times through the pandemic. And our most recent sort of last year, the run-up of cases, we saw a longer tail of Hispanic and Latino cases, often pronounced after holidays. And I know that you're going to see it and say, hey, Christmas was back in December. This data is a little bit lagged. And so I just want to point out that you're going to be seeing a lot of these differences through the pandemic, where the Latinx population is more affected. So it's just another important consideration for our community, and also an important consideration from the point of vaccination, that this group can gain a lot of benefit from being vaccinated. So the next question is why is this happening? And we in public health recognize something called the social determinants of health, where we grow up, who we grow up with, our access to care, a lot of different things in our society have an impact on our health and often dictate our future, our health future. So some of these things are like where we work. During the pandemic, if you're a critical infrastructure worker, it was really hard to work from home, which made it sometimes more dangerous or more possible for you to be exposed to COVID-19. Some other things are like lack of adequate paid sick leave. Living conditions are different in different groups. In some places, population densities are higher. There's closer or further away from medical facilities. Sometimes there's residential segregation, multi-generational households. And a lot of times these things aren't necessarily bad. So a multi-generational household can be really great for childcare, for having resilience, and someone that can help you in a pinch. And I want to also, point out that there are other things too, like underlying health conditions, like age, lack of insurance, language barriers, and stuff that all have an impact on our susceptibility to COVID-19. And particularly in the Hispanic and Latinx population, some of those prominent contributing factors are the inability to work from home, deep social networks, and multi-generational housing. And social networks are a good thing, and so is multi-generational housing. These are things that usually make a population really, really resilient. It's just that these things are also risk factors for the spread of COVID-19. So the things that make the Hispanic Latinx population so strong become an Achilles heel in the face of COVID-19. And so it's not something that's specific to the Hispanic Latinx population. It's any group that is unable to work from home, has a deep social network, or has generational housing is going to be at higher risk. So now I want to jump into a little bit of vaccination data. The conversation for a while was just making sure that enough vaccine got to different places across the state of Michigan. And one of the ways that the state of Michigan decided how to allocate vaccine was by something called the Social Vulnerability Index. And you may have heard some conversation about that. Basically what it is that the CDC established a metric that would basically assign a score to different counties and census tracts across the nation. And that score was used by the state of Michigan to decide how much vaccine to give a particular county. And Ottawa County has a very low social vulnerability index. Overall, we do have pockets, some census tracts that have a higher social vulnerability index, but the county overall has a pretty low index, which means we didn't get as much vaccine as some other counties in the state of Michigan. And some of these things were out of the control of local public health here in Ottawa County. We definitely advocated for more vaccine and continue to do so, but just please be aware that some of the, if there were shortages in vaccine here in Ottawa County, some of that may be driven by allocations based on social vulnerability. Despite, some of the shortcomings in the amount of vaccine we've been allocated here in Ottawa County, we still tend to outpace the state in the amount of vaccine that we've given. So if you look at these sort of dials, think of them like a dial on the dashboard of a car. You can see that the needle is in the gray zone right now. And in Ottawa County, we've given 63,000 we've had vaccinations completed in 63,650 people age 16 and above. So that's 27% of our population, 16% age 16 and older, that have completed their vaccination series. When we look at those who are age 65 plus, over 29,000 people have completed their vaccination, which is about 65% of everyone 65 years older. So again, this is all races and ethnicities. And then when we look at race and ethnicity for vaccination here in Ottawa County, one thing I want to say, and I'll repeat this on the following slide, is that race and ethnicity data for vaccinations given are not available across the entire county. It has not been made available by the state of Michigan to local public health to be able to characterize and show this data. The data I have here is for vaccinations that we've given through the Ottawa County Department of Health clinics. So we account for somewhere between 25 and 35% of all the vaccinations given. So this is a smaller snapshot of the entire county, but it is some data that I at least want to share. So here in Ottawa County, among people age 65 plus, among the Hispanic and Latinx population, about 6.2% are age 65 and up. And among all of the vaccinations we've given at Ottawa County clinics, the people that are 65 years and older, 8.5% of them have been from the Hispanic and Latinx community. So I want to recognize that we still have a lot of work to do. The health department and our entire community on making sure that our minority populations and other subgroups are served and their needs are met and they have access to vaccine. But I want to let you know also that the data that I have now for some groups suggests that we are approaching equity. Again, we have a lot of work to do, but this is just a snapshot into the data that we have here through the Ottawa County Department of Public Health. And when you look at the vaccinations that have been scheduled by Ottawa County, about 12.5% of the population that's been registered and received an invite for a vaccination, it identifies as Hispanic or non-white. So this isn't specific to the Hispanic and Latinx population. It's basically to the entire non-white population, but the vast majority of these are Hispanic and Latinx. Again, race ethnicity data isn't available for the entire county. This is just for Ottawa County Department of Public Health vaccination clinics. We do have data that's available at the state level. And I apologize, I think that some of the headers are covered here, but this is basically the proportion of different age groups and also by race and ethnicity that have been vaccinated in the state of Michigan. And the main thrust of this visualization is that the Hispanic and Latinx population, the proportion in all these different age groups is lower than their non-Hispanic white counterparts in those age groups. And so the biggest gaps proportionally are these younger age groups. And we do know that there is more vaccine hesitancy in some of these younger age groups. And it's just important that we're all part of the same community, the same herd that needs immunity to try to slow down COVID-19. So if there's one group that we want to make sure gets the vaccine, it's these higher risk older groups, but then also if we're trying to get vaccines in arms, there's a lot of opportunity in these younger age groups. But also just making sure that we're working to overcome these gaps, these disparities, and making sure that the Hispanic and Latinx population has a good opportunity and access to receiving vaccine. And we know here in Michigan that our Hispanic and Black populations are going to be hesitant, or were hesitant about receiving vaccine. Back in December of 2020, the state of Michigan did some polling, some surveying, and it's just found that the Hispanic and Black populations in Michigan were more likely to be hesitant about receiving vaccine. And other research that's been done at the national level just indicates that it doesn't matter how many times someone who's an expert gets up and says that it's safe and effective. A lot of times at the end of the day, and that's a theme that's kind of come out in the discussion today, is that we tend to trust the people around us. And I think it's really important for the folks on this call and community leaders to be a good source of information and a good service to our community and to contribute to the community good and hopefully encourage vaccine, as appropriate to the folks that we represent and the folks that we care for. And so please continue to share that message with our community. And so then one of the questions is what has Ottawa County Department of Public Health done? One of the main things is that we've just maintained, hopefully, continuous collaboration with our community. So we've partnered with over 20 different organizations in the community, many of which are represented on the call today, faith-based organizations and other leaders, just to make sure that we are doing our best to reach the Hispanic and Latinx population, but also so that feedback can come back to us here at Public Health. We don't operate in a vacuum. We want to make sure that we have an ongoing conversation with the community and take any of those needs and implement them. So make the changes that are necessary, for accountability, for access, for reducing any of the intimidation that people may feel coming in to any of our clinics. So please keep that kind of information coming. We've also developed social media campaigns and other ways to make sure that people are aware. And I realize that there's a lot of people that don't have access to tech, so we'll talk about that in a second. But we have a whole YouTube channel with lots of information and with questions that people may have about the vaccine or about the clinics that are offered, what to expect, and other questions. And many of them are available in Spanish. So please check out that. If you want to see a tour of the Civic Center, or if any of your clients or friends want to know what it would be like if you end up receiving your vaccine there, please check out our YouTube video that will just walk you through what the experience could be like. We've also been working to combat misinformation and rumors. We're working with other collaborative organizations like the West Michigan Regional Vaccination Collaborative. You can find information on their website. And then the Michigan Coronavirus Task Force on Racial Disparities has a lot of information that we've been trying to use to make sure that we improve access and help do our best to alleviate those disparities. So Just want to talk a little bit about vaccination sign up and registration here in Ottawa County. We're going to talk through some of the tech stuff first, and then I'll talk a little bit about the sort of non-tech options. So if you've got access to the internet, please visit our website. That's step one. Click on this I want a vaccine button, and that way you can get registered. There's also an option at the top of our website where you can hit translate, and it will translate it to the language of your choice, which will hopefully help navigation if you or your community have any language barriers. There's also QR codes. So if you've got a smartphone, especially one of the more recent versions of the iPhone or the Android, you can hold up, open your camera, click on the basically the camera, and just point it at the QR code, and our sign up page will open. And Spanish translation is available on that registration form. So I realize these are high tech options, and that's why if you know someone that doesn't have these kind of tech options, in addition to being a source of trusted information, if you could also do your best to help people who need help with tech to assist them wherever possible. So if you've signed up that way, the next step after signing up is once we've sent an invitation, which will come via email or text, to select an appointment date and time. You'll get an email that looks like this image on the left side of the page, this email. And then inside the email, when you scroll down, there'll be options for different clinics that are available in the upcoming week. You click the schedule an appointment button, it's interactive, and then options will come up for people to be able to sign up for vaccination, so a specific date and time. So these are different ways that we've been working in the community to get people signed up. But if you don't have access to a smartphone or access to a computer or access to Wi-Fi, please give us a call. So there are a couple numbers listed there, and we do have Spanish language services available. You'll get someone that speaks Spanish to help you get signed up. So this is a phone-only call list. You don't need to go through any of the internet stuff. If you know someone in your community that doesn't have access to technology, please, if they have access to a phone, give us a call and we can get them signed up or registered or help them navigate that process. So this is through the Ottawa County Department of Public Health. And just kind of reiterate that if a phone is available, those are the options. And then when no technology is available, so if there's no phone, nothing, our reliance is on our community partners. So folks that are on this call and others in the community, we have over 20 community partners. We just rely on those folks to be able to be the hands and ears and mouthpiece for people that don't have that. So we have a direct and formal relationship with many of these community partners that can directly help people get signed up to receive vaccines. So hopefully those community leaders help people who don't have the technology they need to get access to the vaccine. And if you want to be a community partner, here's just some information on how to make that happen. So if you want to reach out to Sandra Lake here at the health department, she is our point of contact and help people get access to the information they need. And if you want to be basically a community champion that can help people get signed up, this is the way to do it. This is the person to talk to. So I encourage you, if you haven't already, reach out to Sandra. Lastly, other ways in the community to get signed up for vaccination are on the vaccinatewestmichigan.com website. There's a ton of options there, and maybe even a little bit intimidating, but hopefully the interface is a little bit better. Basically, you can pick the county that you want to get signed up in, Kent County or Ottawa, other West Michigan counties, and simply click register. That's an interactive button. You click it and it'll bring you to the website where you can fill out the information necessary to sign up. But I want to let you know it's not just health departments that are providing vaccination. There's other ways too in our community. So there's a large clinic that's provided through public health at the Civic Center. There's other clinics through other community partners. We've partnered with St. Francis Church, and just to the point of we recognize that it is really important to provide vaccination in an environment where there's not people wearing camouflage and where there's not a strong police presence. And so there are other places too where you can get vaccinated where hopefully people feel a little bit more comfortable. If you're comfortable going into a grocery store or a pharmacy, you can sign up through Meijer or Rite Aid or Sam's Club. There may be options available here in Ottawa County, even here in Holland. I know that a number of Meijer pharmacies right here in Holland have received thousands of doses over the last month or so. So please check out those as different options available in our community. And other ways to sign up, as one of the commenters mentioned, I think Leslie, is that if you just need one simple number to call 211. they can help people find a way to get vaccinated, and they do speak Spanish. So please keep that in mind as an option. Lastly, I wanted to talk a tiny bit about the FDA approved vaccines. There's 3 of them, and Guillermo talked a little bit about these a few minutes ago. Pfizer, Moderna, and Johnson & Johnson are the 3 that are available right now. Both the Pfizer and the Moderna vaccines are 2-dose series, generally a few weeks apart. You can see the days apart listed there. So all of these vaccines are safe and effective. And even though that message is really important to continue to put out there, I just want to say that, again, some of the people that we trust the most are the people in our social circles. So if we could all be, knowledgeable and trusted contacts for the people in our lives, that can have a tremendous impact. And I also want to clarify, Guillermo talked about this a little bit ago, just kind of talking about the use of fetal cell lines in the development of some of these vaccines. Just want to clarify that there are no fetal tissue and no fetal cells actually contained in these vaccines. I think that's a really important distinction, that if you get a vaccine, there will be no fetal tissue or cells injected into you. So please keep that in mind when you're making your decisions and weighing the ethics and morality of which vaccine to shoot for. But here at the health department, what we want to say is all vaccines that we have available are safe and effective, and we want to make sure that it's as available as possible. So any vaccine right now is going to be a good, safe, and effective vaccine. So Yada, that's, I think, it for me, and I'm all ears to what people's questions may be. Thanks.
Thank you. So yes, at this time, are there any quick questions in relation to the information that was just presented? If not, we are going to go ahead and do a quick polling, and then we will go on to a list of frequently asked questions, as well as open it up to any individuals who might have a question specifically on the COVID-19 vaccine. For example, can you get reinfected with the virus? Kind of questions like that. So I do have a question here in the chat. So Walgreens in Holland also is providing vaccines in Holland, Michigan by appointment with no requirement or insurance. I guess that one first is a comment there. But question, if someone gets sick and misses the second dose appointment, how does one go about scheduling an appointment with the Ottawa County Public Health Department?
I'll do my best. What I'd say is call us. Per the CDC, you have 6 weeks to get your second dose of vaccine. So if you haven't, please give us a call. We'll do the best we can to get you connected. It's really important, and we try to do everything we can to make sure that when you're signed up for your first dose, that you're aware of when the second dose is going to happen. We try to make it really hard to get out of the clinic without getting signed up for your second vaccine. So, and we realize that life happens. And so what I'd say is please give us a call. We'll do what we can. We're not perfect, but realize that too, when you sign up for the vaccine, and this is important, if we put the date that the second vaccine will be available to you, and if you can't make that second dose appointment, please don't sign up at that time. I'll look for invitations in the future. This is sort of the process that we're using right now to try to ensure that everyone gets their first and their second dose. So give us a call if you didn't get your second. And be aware that when you sign up, you're signing up for a pretty specific second dose date. There's not a lot of flexibility in when you get your second dose.
If I could too, Yetta, please just insert one comment. Darrell mentioned that the Ottawa County Health Department set up a clinic at St. Francis de Sales Church. And that's the church that I work at. And I wanted to just say that they make it very easy on you. So if there are other community partners out there, other churches that might be considering doing this, they make it really, really easy on you. And it was a really good experience. And we had hundreds of people vaccinated at our church, hundreds and hundreds. And it was really well organized and really well done.
Awesome, thank you for
I have
that. additional comment.
I have a question, Yava, for, well, actually, I have
Yes.
a comment. This is Chuki, and it's for Darrell. I've been a volunteer on Sandra's committee, scheduling Spanish speakers for the vaccine. And one thing I keep running into repeatedly is people who interchangeably use the word register and schedule. They seem very confused, so that when I offer, I will always say, I got your name and number from this person. Hispanics tend to be very relationship oriented. We trust others that we know, and that, so then I tell them this is who told me you were interested in a vaccine, and I go on, and so that opens it up really well. But then some of them will tell me, well, a friend, a relative registered me, so I'm all set. Do you have an appointment? No, but they registered me. So there seems to be a lot of confusion between registering for that vaccine and actually getting an appointment. And yet when I see literature, in fact, I believe some of your slides also would say, do this to register. And that seems to confuse people. They think they have an appointment, they're all set. They think that they can show up at a clinic without the appointment. So I would just encourage everybody who reaches out, whether it's written or not, to distinguish between those two words, that you are registering for a vaccine when you do this, but you're scheduling an appointment when you do that. That I keep running into that repeatedly.
I can speak to this a little bit. I so appreciate that question or that comment, because there's a real distinction between that. Early in the vaccine rollout phase, vaccine was, the supply was anemic. There wasn't much out there. And so most organizations, including the Ottawa County Department of Public Health, created a sign-up process where basically a list was created. So you would sign up and you would register. And so, yeah, you can see the confusion. You'd register to receive an invite to be signed up for vaccination. And that process is still going on. So when you sign up online, you're going into a pool that receives invites to vaccination clinics. And so, yeah, I'm probably not providing a ton of clarity, but what I want to say is this: as vaccination becomes more and more available, distinguishing between those two words, sign up and register, are going to be less important, because at some point someone's going to be able to open up a list and say, I want this clinic date, and sign up and have that spot available for vaccination. What I'd say is check with some of our community partners, like our pharmacies. They may be more available to offer like a legitimate, this is the time and place that you come to receive vaccine. Here in Ottawa County, we're still sending invites out to people who've signed up to receive invitations to our vaccination clinics. And so my hope is that this process will become clear as more vaccine becomes available and more people have been vaccinated, and so there's less demand. So what I'd say right now is, if you're going through the Ottawa County Department of Public Health, we have a link on our website that says, I want to sign up to receive the vaccine. Click it, you go into a list, and we send invitations out via email. If you call us to sign up, the process is a little bit different, because I want to make sure that people that don't have access to technology can just give us a call. And hopefully the process that we provide there is a little bit more direct. And so we recognize that people have different access to technology. So please give us a call, and hopefully the process will be a little bit smoother.
This is Viola. I have also sit on the same scene with Chuki, but at the organization that I work for, we were responsible for reaching out to our members and making sure that they were signed up for the vaccine clinics. And one of the biggest barriers that I had found with the those that are analog challenged is, though they are not necessarily one to answer the phone, because we've trained ourselves not to answer unknown calls. So my question to you is, what process is Ottawa County doing with being able to reach out to people that are technology challenged? And is it a continuous call back if they do not answer the telephone? or there's no room on the voicemail?
Well, that's a really good question. At the Ottawa County Department of Public Health, we do use some technology that will reach out to people, and it will come from an area code that is not 616. And that can be really confusing to people. And I also would be hesitant to answer the phone. What I'd say is if you've signed up to be on our list for invitations, be aware that you may be getting a text or some other technology from an area code that you don't recognize. And so just be aware of that. And we do our best to try to self-identify. Like, this is from the Ottawa County Department of Public Health if it comes in via text. You don't have to answer the text, but we also would say then to, please check your email, because if you signed up via email, it gives you a little bit more opportunity to read through, to see the header, to see, yes, this is marketed from the Ottawa County Department of Public Health. They're not asking for my social security number, and we won't. We're not going to ask you for those intimate details, that personal information, because we don't need it for you to get signed up for a vaccine. And we don't routinely do calls to folks. If we do calls, working through a list, it'll be from a 616 number. And so what I'd say is if you're signed up and haven't received a vaccine and you're getting a call during business hours, maybe even a little thereafter, please pick it up just to see if it's from us. And also we're working hard to make sure that there's more vaccine available. So hopefully all this technological back and forth will get a lot easier, because people will just be able to walk into Meijer and get it, or walk into a grocery store of their choice and get it. And so one of the questions that Yada set up for this panel was, what are the primary barriers that you're seeing? Vaccine hesitancy is real, but so are the technological barriers. And so I want to let you know that we are working really hard to try to overcome some of those, and some of them maybe we may not be able to overcome them, but we hope that supply and more community partners that have vaccine available will help make it easier for our entire community to get vaccinated.
And is the method of communication that will result from Ottawa County part of the standard script if somebody is registering by phone? Will they be told that there will be an unknown number or an outside area code number that will be reaching out to you?
That's a good question. So Viola, what I'm going to do is I'm going to take that back to our team. And if we've got a script that we're using, I'm going to make sure that gets added, that if there's going to be some way that we reach out technologically, that you know what to expect. And so I think that's a really good point. And even though I don't have an answer, I'm going to make sure that if there's a gap there, that I get that fixed.
Thank you.
Thank you. And I would like to quick interject here before we continue with any questions and moving on to some frequently asked questions. Cam, if you can go ahead and start the polling questions. So just a quick couple of questions here, if you could respond to that, and then we will continue on with questions that audience members can ask our panelists. And then I think with that, the majority of individuals most likely already responded. If not, please feel free to finish up your responses as we do open it up again for questions. So again, frequently asked questions. If you all have any questions you'd like to ask our panelists, whether that be specifically questions again, which is the first one we would open up with, can you get reinfected with the virus? Or things related to that nature, please feel free to voice your question. So I will open it up with that question. Can you get reinfected with the virus once you've already been infected with the virus, even if you've had the vaccine or not?
Hey, Yada, I can answer. Sorry, Guillermo, go ahead.
So there was another question in the chat too, but I was just gonna say, as far as the reinfection, we're still kind of in that. It's the hardest part of all this is that it's so new and it's really hard to keep up with the data and really how to even like ask the questions and get all the information. So as far as we know, the data are kind of scarce, but it does seem that on a very rare occasion you could get reinfected. So, but it's a very, very unlikely kind of thing, and that's the impression I'm getting from the data from both people who have had COVID before and those who have the vaccines. But I don't know if you want to add anything to that, Daryl.
Yeah, thanks, Guillermo. I think that's really important. From the data that we're seeing is yes, people can get reinfected, but like Guillermo noted, we don't have all the data yet. So we don't know if you get infected with the same strain of COVID again, because we are seeing lots of evolution in COVID as it moves through the population. You hear words like variant. So there are other variants of COVID-19 in our community. So it may be that someone who's exposed to a earlier strain and gets exposed to a variant, that the variant may still be able to infect them. But to reiterate what Guillermo talked about, this is a very rare occurrence.
I would like to add to what Guillermo and Daryl have said, that just to make it clear to the community that the vaccine is not to prevent you to get infected. It's to prevent you from getting symptoms that are associated with COVID-19. The vaccine, what does is to interfere with the virus and the interaction with proteins in the surface of your cells that allow the entry of the virus inside the cell to replicate, infect other cells, or also generate enough particles of the virus to spread to other people. So the vaccine do not interfere with the infection. What interferes is with the symptoms to protect you to develop symptoms. So a person that is vaccinated has a very low probability of develop symptoms and a low probability of spread the virus to others. However, as Daryl mentioned, as we are having more variants that are more infectious, like the V117 that is more prevalent now, that probability of being vaccinated and develop symptoms, which because V117 not only is more infectious, it's actually more severe in terms of the reaction. You might develop symptoms, but still the symptoms will be less than if you were not vaccinated. But also you might be able to transmit or spread the virus if you are infected with the V117 than with the original virus of the COVID-19. So again, I just want to emphasize that the vaccine is to prevent you from developing symptoms. You still need to observe the public health recommendations, even if you are vaccinated, of wearing a mask, washing your hands regularly, and social distancing, because you might be a vector, unlikely and low probability, but you still might be a vector to someone that is not vaccinated.
Yeah, I think that's a very good point. In that, you kind of, sometimes you hear with the numbers like, Johnson Johnson's only like 60% effective or something. Like you hear that sometimes. But I think if you were to ask somebody what's more important, not getting COVID or not getting sick from anything that's considered COVID, I think most people would say that it doesn't really matter if they have COVID if they're not really feeling symptoms. And I think that's what the vaccines are there to do. I think the risk of really, really, really bad infections, hospitalizations, and deaths drop precipitously if in people that are immunized. And I think that's the important part, is to protect your health, not so much that you can't, that your body can't see the virus. Does that make sense?
Yes. Well, I hope if it does not make sense to any of our event attendees that they voice some questions there for clarification. I do want to be respectful of everybody's time. We are at 6 o'clock on the dot, So before just heading into our closing comments and our thank you to all the panelists and event attendees tonight, are there any last minute questions for our panelists?
I think I'd like to address the one that was in the chat, if that's okay.
Yeah, definitely. Go ahead, Guillermo. Thank you.
Martinez was asking, because this is something I hear all the time about concerns for the virus or for the vaccine because it's so new. Health, it's a new way to do it. It was put out there quickly, as everyone was saying. This is a lot to do with just technology that's existed, but we haven't had the time to ramp it up and use it in the way that it could provide these vaccines. In regards to repercussions in the future, I think it's true that we don't know what, like in the future, what could happen. Like anything could happen with whatever medicine that you're taking, any vaccine that you do. I do want to say that a lot of the concerns that people have for other kinds of vaccines, like reactions to things that are in it, potential health effects on the line, which a lot of times are unfounded, but people have concerns to what's put into your vaccine. As far as, I'm just going to talk about the main RNA ones. It's new technology, Moderna and Pfizer. These are about as simple as it can get. So most vaccines are based on like introducing a protein in your body and having an immune response to it. These aren't even doing that. These are giving you the recipe for your own body to make something that looks kind of like the virus so that it can make its own antibodies and protect itself. So from that sense, it's just RNA, a little bit of fat and sugar. And really they use these fancy words if you look at the ingredients. So that's really what it is. You're not even putting a virus in, you're not putting proteins in, you're just saying, here, make this and protect against this, which I think is really exciting from the standpoint of we can change this really quick. We've heard about these new variants. Like what if we got a really, really virulent mutant for COVID? We have the technology that we could create a vaccine pretty quick to that. And I think that's exciting as far as like trying to prevent future pandemics. But we're taking out a lot of the things like preservatives. Sometimes we heard about things that were added into vaccines to preserve it. One of the reasons it's so hard to transport these is because we have to keep it so cold because RNA isn't the most stable, which in the sense it's, should give a little assurance to the safety too. It's so unstable, it's not going to live long in your body. You're just giving your body enough time to see it, read the recipe, make it, and then be able to protect down the line. But more of the question was, what effects could this have down the line? Your body's seeing RNA and fat and sugar and all this kind of stuff all the time. So we don't really have a reason to believe that this is going to be any different. But what we do know is that COVID can cause really, really serious disease. Not everyone, but in a percentage of the population, especially those with comorbidities like heart disease, lung disease, if they're obese, if they have diabetes, or maybe if they're just in the older population, they're even more at risk. And we know that really bad things can happen if you get COVID, not only in the lungs, but we know it can affect the GI tract. We know it has to affect some sort of nerve because people are losing their ability to smell and to taste. We don't know the long-term effects of COVID infection. We know that you can get really sick. We know you can die from this. There's no question about it. And we don't know like what the effects on the lungs are going to be from people that had to be treated for getting COVID or any of these other problems. So we know really bad things happen now with COVID, and we don't know how bad these effects can be down the line. So I would always hedge my bet on that knowledge versus, something that I know can prevent this disease. We know COVID can be really bad, and we have no evidence really to the contrary that these vaccines are causing anything like this. Side effects aren't really, when you think about it from an immune system perspective too, you reacting to the vaccine is kind of what you want your body to do anyway. You want your body to see this and say, hey, I don't want this kind of thing in my body. I'm going to create antibodies to it down the line and protect myself from it. So we will continue to surveil these kind of things, but I think it's really important to understand that COVID is a presence right now that is really bad and can affect us now. And we don't know what it's going to be doing down the line. I think that we should, moving forward, understand that we probably should do everything in our power to prevent getting it and spreading it to others.
Thank you so much, Guillermo, for responding to that last question. Again, just to make sure we're respecting everybody's time, to start off our closing comments, I would like to ask Kim to share with us the results from our polling questions here. So we have 100% of individuals who responded to the poll say that yes, they've already had the COVID-19 vaccine. Here we can see some reasons that they selected as to why they made that decision. And thank you to those individuals who have the time to be able to assist with clinics in our area to be able to help other individuals get vaccinated. With that being said, thank you again to all of our attending, all of our event attendees for tonight. And thank you to all of our panelists for sharing their knowledge and insight on these topics. Again, our goal for this event was to highlight what challenges the Hispanic Latinx community has in trusting medical professionals historically and the COVID-19 vaccines specifically. To also provide insight and comparisons on the FDA approved vaccines and to discuss how we can move forward in our community to ensuring all who wish to receive the vaccine have access to it and understand from others why some may choose to still abstain from receiving the vaccine at this time. I hope that you as an audience feel that we've accomplished this goal. Thank you again to all who attended and to our panelists.